Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video we're going to be talking about disseminated intravascular coagulation. Disseminated intravascular coagulation. And this is also known as DIC. Of course, we have the D for disseminated, the I for intravascular, and the C for coagulation. So this is, again, another scary medical term, but what it means is really actually quite simple. Disseminated means all over or all over the body. Intravascular means inside your blood vessels. And coagulation means clotting. And we've talked about clotting before. So disseminated intravascular coagulation really just means that inside all of your blood vessels, all over your body, you have small clots forming. And so we've talked about clots before. They're kind of this matrix of clotting factors, of platelets, red blood cells, and all together these form a clot. And so in DIC, you get very, very small clots all over the body in the blood vessels. And so this by itself causes lots of problems. You can lead to damage to other organs, like your lungs or your kidneys. But the big issue during pregnancy, and especially during postpartum hemorrhage, is that you use up all of your clotting factors. So all clotting factors are used up. And this should hopefully make sense. All of these clots are forming in your body, and you only have so many clotting factors. So many of these proteins in blue, these are clotting factors for CF. So clotting factors, and you only have so many of these clotting factors floating around your body. And so if you have all of these small clots forming all over your body, then in the uterus, where you may be bleeding out during postpartum hemorrhage, you can't form any clots. You can't stop the bleeding in the uterus because all of these tiny clots have used up your clotting factors elsewhere in your body. We won't go into too much detail about the mechanism of DIC, but some of these small clots can be triggered by proteins secreted by the placenta. And so in cases of placental abruption, for example, and we'll talk about that in another video, the placenta releases proteins into the mom's body, which causes these small clots to form. And then that leads to consumption of all the clotting factors in DIC. During postpartum hemorrhage, in rare instances, just from bleeding a whole bunch, you may lose a lot of your clots that are supposed to be stopping the bleeding inside the uterus. And so all the clots end up basically on the floor, where all of the postpartum hemorrhage blood is coming out of the woman. A lot of that blood coagulates, forms large clots, and then again you run out of clotting factors, and again it leads to DIC, where now the woman doesn't have enough clotting factors. So the big takeaway is that you run out of clotting factors, no more clotting factors. I'll say CF for clotting factors to stop postpartum hemorrhage. So this is really what ends up killing the woman is the postpartum hemorrhage, but it's because she no longer has clotting factors to stop the postpartum hemorrhage. So she'll just continue to bleed and she'll never stop bleeding because she has no clotting factors to stop the bleeding in the uterus. And so in previous videos, we talked about how the muscle contractions of the uterus stops the bleeding, and that contributes for sure, but you still need the clots to form to really solid up or really solidify the stopping of the blood or the hemostasis from causing more bleeding from happening. So the next thing that I wanted to talk about was what tests should be run. So there is a protocol up north. It's SAIGNE. So this is the code for postpartum hemorrhage. And in this code, there's a test for PT, prothrombin time, and there's also INR. So it's not important exactly how these tests work, but basically at the lab they test how quickly the woman's blood clots. How quickly blood clots. And so they use specific timing, they use specific conditions, temperatures, and things like that. But basically they're just measuring how quickly the patient's blood or the woman's blood will clot. So while we're talking about blood tests, one thing that's important to know is that most blood drawn vials or tubes contain anticoagulants. And so we've talked about coagulation, we've talked about coagulants. Coagulation just means clotting. And so these test tubes that you drop blood into have chemicals that stop coagulation. So anti just means to stop, or the opposite, and it stops clots from forming. And this allows the lab to get blood from the patient that's not clotted. So it's still a liquid form. They can pipette it into things. They can run tests on it while it's still a liquid. But inside of this protocol of vials of tests to run, there's a red capped tube. Red capped tube or vial. And this tube does not have anticoagulants in it. And the reason that this is important is that if you drop some blood into this red capped tube, you can check yourself for how quickly the blood clots. And so if you just keep it warm, so I think in the protocol it says to keep it in your bra, but really just keep it warm. You can keep it if there's someone who's not doing anything during the postpartum hemorrhage or whatever, they can even just hold on to it, but they just have to keep it kind of close to body temp. And the blood inside of this red cap tube should clot within 7 minutes. So should clot in less than 7 minutes. So if you just start a little timer or put on alarm for 7 minutes, if you kept the tube warm with the blood in it, it should be clotted, it should be coagulated in 7 minutes, and it'll turn into kind of more of a jello consistency. It'll form a blood clot within 7 minutes. And then if it hasn't formed that clot, if the blood is still a liquid in 7 minutes, this means the patient likely has DIC. So if not, this means the patient has DIC or some form of a coagulation problem. So it doesn't necessarily have to be DIC. It could be some other form of coagulation issues, but this means you have to treat this patient as if they have an issue with their clotting. And so the treatment protocol for issues with clotting is to give what's known as fresh frozen plasma. Fresh frozen plasma, for FFP, for fresh frozen plasma. And FFP has clotting factors in it. Has clotting factors. And this is from donated blood, so it'll have other people's clotting factors in it that will then be able to replenish all of these clotting factors that have disappeared due to small clots all over the body or because of the bleeding from the postpartum hemorrhage. Okay, so hopefully this is kind of a quick overview of what DIC is, why it happens, what tests can be used to identify it, and even a little bit into how you can treat it or how the physicians will treat it.